Hello, everybody. Andrea Tarowski here with Dental L Tutoring. It's a little bit chilly today, so I do actually have a sweater on, and I have a tee also, so it's a little bit chilly out. It's not summer, that's for sure. In the video today, I will be talking to you guys about oral cancer because I had done a video last week about oral pathology and some of the common oral pathology lesions that you might see in the dental office. And somebody actually had commented and had an excellent question about, well, how can you tell or think you might be able to tell if a patient has oral cancer? Sorry, my puppy was trying to hop up here. How can you tell if your patient has oral cancer? What are some of the signs and some of the symptoms, and what could something like that look like? Part of the question was also, if you see signs of oral cancer in the mouth, could that mean it stems from somewhere else in the body? You know, could it mean that also? So I'll be talking about all of that. I have some screen shares to actually show all of you. So let me just start my screen share right now here. Let's see here. Sorry guys, this always just takes a moment. Desktop, let's see. Now, can everybody see? You guys don't need that, you don't need that. I wanted to show you guys the oral cancer lesions first. So can everybody see that okay? It looks like everything's working. I'm actually going to make me smaller so that you guys can see these things larger here. Okay, so I had simply typed in oral cancer in the search field up above here. Now, you have to be careful though anytime you do a search online, because it doesn't mean what you're seeing is actually what you're searching for. So you do have to be careful, but these are clearly oral cancerous lesions. So a rule of thumb is usually if the lesion just looks not right, if it's large, if it's white or red or purple even, or blue, that's not normal. It's a good idea also to tell your patients to have them look inside their mouth often. You know, check on the side of the tongue, check under the tongue, check the roof of the mouth, all of those places, so that if something ever comes up, like an oral lesion of some kind, they would be able to tell, like, oh, I've never had this before, you know, maybe I should have this looked at. Or they could say, oh, well, this lesion I've just always had, so it's normal for me. So something else to keep in mind. But I want to show you guys a pretty obvious picture here. Now, this is clearly, I'm just gonna make it a little bit larger. This is not normal. Now, I can't say for sure this is oral cancer because I don't know the lesion and I don't know the patient, but this isn't right, okay? So you see all of these white areas here. There's a red oozing area in the middle here. That isn't normal. So if I saw that inside the mouth, I wouldn't say to them, you know, this could be oral cancer. Give it a couple weeks. If it's still there, let us know. No. If I saw something like this, I would say, let me speak to the dentist. He or she will be in right away, and we will likely refer you to a oral pathologist to have it looked at. My puppies are playing in the background, so sorry if you guys hear that a little bit. So this is clearly not a good sign. Let's look at some of the other ones here, because some of these I can actually tell aren't oral cancer. So a good example is this one here. So this, I mean, I can't say for sure, again, because I don't know the patient, and I'm not where this person is. But this to me isn't not a clear sign of oral cancer, because this kind of looks to me like it's on the inside of the cheek, because you can see the tongue here. So the inside of the cheek, this could be leukoedema, it could be a form of linea alba, and those are all normal. They could be precancerous, meaning that if the condition continues, or if the condition gets a lot worse, then it could turn into cancer. But if I saw this, I might say, you know, I don't see this often. I would keep an eye on it. Let me have the dentist have a look if he or she thinks that they should be referred to a oral pathologist, and that might be a good idea too. But you know, if I see something more like this, this to me is not a good sign, right? Because this is quite large, it's quite prominent, it's white, it's covering a large area. That to me is saying it could be a form of oral cancer. I'm just going to have a little bit of my tea here. Yummy. Okay, so some other examples. Now, this to me kind of looks like it could be quite a prominent form of linea alba, maybe leukoedema, but I'm more inclined to say no, because it looks more like oral cancer to me because it's covering such a large area, and it just looks not nice. You know, it's hard to explain. Now, if the patient says to you, well, I've never seen this before, it came up about a week ago, I would be concerned. If the patient says, well, you know, I have had it like that for 5 or 6 years, it looks the same to me. Now, that may be a good thing, or it may be a bad thing. It could be a bad thing in the sense where they've had it for 5 or 6 years. It could be oral cancer, and now it could have spread to other areas of the body if it is oral cancer. Or it could mean that this is just sort of normal for them, especially if they're chewing on the inside of their cheek. So sometimes it is hard to say, but again, a good rule of thumb is look at the size, look at the shape, look at the consistency, look at the color. Is the patient in pain? You know, things like that. Now, it's easier with experience also, but I know when I was in school, I thought I saw quite a few cancerous lesions, and my instructors thought the same thing. So we had the patients go to an oral pathologist just to make sure. And even if the oral pathologist says, no, things looked fine here, you know what? That's okay, because that is telling the patient that you weren't sure, but it's nice to know that, you know, they do not have cancer, right? You would feel horrible. Oh, sorry, you guys, my puppy's really loud. Somebody's probably walking on the sidewalk. Okay, I think she's stopped for the most part now. But on the other side of things, you don't ever want to say to the patient, well, we've been keeping an eye on this for a month now. Let's send you to the oral pathologist. And then the oral pathologist says, yeah, they have cancer. They've had cancer for about a month. We would have liked to see them, to have seen them sooner, to treat it a lot easier. You know, that's not something you want to hear, right? So if you're not sure, if there's something in the pit of your stomach that's saying, I don't like the look of this, tell the dentist right away, and then the dentist can refer them to an oral pathologist, okay? There's no harm at all. Sorry, you guys, I thought I heard my puppy again, but she's fine. She is playing with her toy. But I wanted to actually show you guys things that are normal, that may actually look like they're cancerous, but they're normal. This is very common, and if I was a new student, newly working in the dental office, I might say, oh my God, that looks horrible, right? But this is very common. So does anybody know what this is? So this is something called, now it could be called a couple things. We typically call it a geographic tongue. It could be called ectopic geographic tongue. Those are kind of the main names for them, but this is normal. Now, my brother actually has this, and sometimes you see it on his tongue, and sometimes you don't. If he eats a lot of spicy foods, it tends to be more prominent. It's not painful per se, but it could sort of have a tingling sensation to the tongue sometimes. Typically, if the person drinks alcohol, it could make it more prominent, but this is normal. Some people have it and some people don't. And sometimes you will see it at one appointment on a patient, but then they come in for their next appointment and you're thinking, oh, you don't have it now. Did it disappear or something? But no, that is not the case. It's just sometimes they have it at one appointment, but not the other appointment. But that just means that some things make it more prominent. Okay, so that's normal. The next one. Now, this is normal too, but remember how I said earlier to sort of look at a cancerous type of lesion, look for anything like blue, purple, red, white. This is like a bluish purple, but this could be normal. So this is typically called a hematoma. So the patient has sort of a bruising of some kind on the inner lip. This could happen from if they hit the outside of their face, perhaps. It could even kind of resemble an amalgam tattoo, but this person doesn't have an amalgam, so that's not the case here. But this is normal. You may be thinking, oh, well, it's purple or blue, and that's not normal. But in this case, this is normal. And the patient could even have it for weeks, months, years, or for the rest of their life in some cases. Now, if though the color starts to get larger, or if it's more, I guess, it covers a larger area, or it's deeper in color over time, that's not a good thing, and I would have it looked at. But if it just pretty much stays the same, that is normal. Let's see, what other normal ones do I have? Okay, so sorry about the picture here, but this is your maxillary tori. See this lump here? So the picture is a little bit blurry, so I do apologize about that. But that's a lump where some people have the tori on the top of their mouth or on the bottom. This is normal. Some people have it and some people don't. And you could be thinking, well, this is a large lump. That to me is not normal at all. It looks a little bit strange, but you would be surprised. Lots of people have it. So that's a normal one. And this one here, exostosis, okay? This is normal, and I actually have the same thing. I don't know if you guys can see. I'll make the video larger for a second. Now, can everybody see mine? You see that? Right up there, and on the bottom too. I will show you. See that? So I have it everywhere. Now, this is normal, okay? It's just for a new student, they could be thinking, oh my God, what the heck is that, right? But it's normal. So this is normal, normal, normal. Okay, so I think I talked about all of the normal ones. Let's see, everybody. I just want to make sure. So this is not normal. I'm pretty sure this is a cancerous type of lesion. So I think I did answer all of the questions. The best thing to remember is if you see a lesion in the mouth that you're not sure of, that is okay. You know, it is important to ask questions such as, how long has this person had it? Is it sore? Is it painful? Has it changed in size, shape, color? And if you're not sure, have the dentist have a look, and then they need to be referred to an oral pathologist, okay? Because you can't say, this is cancer for sure. No, you can't say that. They need to be referred to an oral pathologist, and then they will do some tests, and then they will know for sure. Even if you're not sure, you know, saying, well, I don't like the look of it. It could be cancer. It could not be cancer. You know, I'm not sure. There's no harm in sending them to the oral pathologist to make sure, right? There is no harm, because with oral cancer, the earliest you catch it, it will actually help the patient a lot more. So if you catch it, say after they have had it for a month to, you know, 6 months, 2 years, that's not a good thing, because it would have gotten a lot larger. But if you catch it in the more earlier stages, it is a lot easier for them to actually, hopefully, take out the cancer and take out the whole thing, and not sort of affect anything else, okay? So if you guys have any more questions, please let me know, and stay tuned for the next video. Let's see here. Let me stop my screen share, and I will see you all very, very soon.